Some people in the trans community have this like weird viewpoint that like to be trans, you have to want to.
This is one of my favorite topics because I have always found it to be really odd, like the standards that some people have for who is and isn't transgender, and then like when I objectively look at my life, right? So I'm a transgender woman who has never had plastic surgery, and I remember getting into so many arguments with people about this. There was this idea that like if I didn't have breast augmentation, facial feminization surgery, a BBL, all types of like classic surgeries that a lot of transgender women typically get, that I'm somehow not trans. Mind you, my body looks like this. Like, you know, I like my body. Do you know what I mean? Like, I think I have a cute body, right? And it's so funny because I used to really want to get breast implants just to appease those particular people. And if you've been watching the past couple of videos I've posted, you know that's kind of weird because I did develop breasts as a teenager pre-transition. So I've always had boobs, but there was something about like this sort of, I guess, it's like for some people, if you don't have that plastic surgery, you can't call yourself transgender. And I find that to be so fucking odd. Like, I really hate when people try to have conversations about other people's dysphoria because everyone experiences it very differently, right? I have always been a person who, for the most part, has appreciated the way that they look. I might have insecurities here and there. You know, there might have been phases of my life where I want this and I want that. And, you know, look, sometimes I think about plastic surgery, you know, at least once a week, right? Get a little of this, get a little of that, right? But at the end of the day, I am actually quite happy with my body, you know? I think for so many transgender people, living in their body is so terrifying and upsetting. And we have this sort of idea that it's a rite of passage to medically transition. And I actually do think that in some way it is, right? In terms of like it shifting the way that your body functions, right? But different people feel differently about different things. And I don't necessarily think it's always productive to sort of suggest that, you know, only certain people who are really trans get this surgery, that surgery, and that surgery. Because if the qualification for actually being transgender is having plastic surgery, I guess I'm not trans. You know, I guess I'm a cis man. And here's another thing. There was this post-op trans woman that I used to follow on YouTube. And one day she reappeared and she was not a woman no more. She had detransitioned. And one of the things that she said, she was an older person, they said, I'm going to say they. One of the things that they said is that back in the day, the standards of care were so harsh for them that as a pretty young boy, this is the way that they described it, as a pretty young boy, they were encouraged to medically transition because so many people said, well, if you're going to be a boy and also feminine, you should probably transition. You might as well, right? Mind you, it's not easy to get a bottom surgery. It's not easy. It's not something that you can just go and do. So, especially back then, I know that she went through every doctor's appointment, every therapy letter. You know, she did the whole shebang and justified herself, especially as a, you know, straight woman who would never want to do any of that gay shit, which was very much part of the standards of care for a lot of transgender women at the time, right? And then she just realized that she wasn't that anymore. And it was shocking to me at first because I looked up to her and I admired her. She, for me, was like goals. But it was a good example of how our narrow standards of care can create a situation for people where they feel like they have to have certain surgeries in order to be respected. And that's a terrible, terrible pressure to be under. I want more transgender people to liberate themselves from the narrative that their transitions need to look like everyone else's. It really doesn't. My transition has never looked like anyone I've ever known's transition. I've met very few transgender women who have had my experience of developing breasts in youth, really being seen as a girl for you know, a really long time, fighting with people over that. You know, I haven't met a lot of transgender women who've had that kind of experience. And so, you know, for me personally, it's important to just acknowledge that we all experience gender very differently and that these standards of care the pressure to, adhere to this particular binary way of being, this particular cis sexist conception of what a body is supposed to look like, that is not helpful or productive. It's actually quite regressive.